Good morning, everyone. Very good morning. हेलो बच्चों बच्चों आवाज़ आ रही है? गुड मॉर्निंग, गुड मॉर्निंग. आवाज़ आ रही है बच्चों? स्टार्ट करें क्लास. Good morning. So obviously in this like hot summer there is a rainy season coming, right? अच्छी अच्छी बारिश हो रही है, मज़ा आ रहा है, राइट? चलो स्टार्ट करें क्लास. चल. So today we are going to learn about आंसर्स देने हैं बच्चों, ठीक है? ऑनलाइन क्लास हो ज़रूर रही है बट इट शुड बी लाइक ग्रेट क्लास, ठीक है? गुड मॉर्निंग, गुड मॉर्निंग. चलो. सो टुडे वी आर गोइंग टू लर्न अबाउट स्लीप. अगर टाइम मिलेगा तो हम गैस्ट्रिक एसिड सिक्रीशन एंड एक्साइटेशन कॉन्ट्रैक्शन कपलिंग भी डिस्कस करेंगे, राइट? सो वी हैव टू डिस्कस अबाउट स्लीप एंड ईईजी. ईईजी क्या होता है बच्चों? इलेक्ट्रोएनसेफेलोग्राम. जैसे हमने ईसीजी पढ़ा था वैसे ही हम पढ़ेंगे ईईजी, राइट? बट बिफोर दैट वी हैव टू नो अबाउट द स्लीप. नाउ स्लीप क्या होती है? हमें पता है कि हम टायर्ड हो जाते हैं, फटीग हो जाते हैं, ब्रेन टायर्ड हो जाता है तो हमें रिक्वायरमेंट होती है स्लीप की, सो दैट रीजनरेशन हो, रिपेयर सिस्टम एक्टिवेट हो एंड क्या हो, हम फिर से दोबारा से एक्टिव हो पाए. बट ये स्लीप जो होती है, व्हाट इज दिस? इट इज नथिंग बट टेम्पररी. टेम्पररी. It's not permanent, right? It's a temporary state of you can say relaxation or better term है temporary state of decreased activity of the brain. Temporary state of decreased activity of brain. डीप स्लीप में जाते हैं, इट्स ऑलमोस्ट लाइक कोमा बट दैट इज अ टेम्पररी स्टेट, दैट्स नॉट अ परमानेंट स्टेट. अंडरस्टैंड दैट, राइट? नाउ हम करते हैं क्या? स्टडी ऑफ स्लीप. हाउ टू नो? आई नो यू आर फीलिंग स्लीपी बट वी हैव टू स्टडी फॉर एटलीस्ट 1.5 hour. गुड मॉर्निंग बच्चों, गुड मॉर्निंग. स्टडी ऑफ स्लीप, इसको क्या बोलते हैं बच्चों? इसको बोलते हैं पॉलीसोम्नोग्राफी. पॉलीसोम्नोग्राफी, ठीक है? अब इसका क्या मतलब है देखते हैं. फर्स्ट ऑफ ऑल यहाँ देखो, पॉली मतलब मल्टीपल, राइट? एंड ये बीच में जो वर्ड है ना सोमनो, दैट मीन्स स्लीप. दिस सोमनो मीन्स स्लीप. सोमनो मीन्स स्लीप. Graphy means, I told you that whenever we take a graphical representation of any recording, we call it as graphy. So it's a procedure in which we convert a signals into a graphical representation, right? So whenever the word graphy is going to come, that means you have to know that there is some procedure in which we are converting any type of signal, some site of signals into a graphical representation. into a graphical representation. So study of sleep को हम क्या बोलेंगे? Polysomnography. Polysomnography. जैसे होता है क्या? EEG. जैसे होता है क्या? ECG, है ना? इसके साथ साथ आप करते हो ECG, है ना? जैसे होता है EOG. अब ये क्या है सब? ECG हमें पता है इलेक्ट्रोकार्डियोग्राफी, है ना? EOG होता है इलेक्ट्रो ऑक्यूलोग्राफी. इलेक्ट्रोऑक्यूलोग्राफी, राइट? क्या मतलब हुआ इसका? इससे हम क्या देखते हैं बच्चों? ऑक्यूलो है, सो हम देखते हैं आई की मूवमेंट, मूवमेंट ऑफ द आई. इलेक्ट्रोऑक्यूलोग्राफी, इसमें क्या देखते हैं हम? इलेक्ट्रिकल एक्टिविटी जो भी स्लीप के टाइम पे हो रही है या इंसान अवेक भी है तो क्या हो रहा है? हमारी आंखें हल्की हल्की मूव कर रही होती है, राइट? सो उस आई मूवमेंट को कैच करके उसको ग्राफिकल रिप्रेजेंटेशन करना है मुझे, सो आई विल यूज अ मेथड दैट इज इलेक्ट्रोओक्यूलोग्राफी, राइट. ईसीजी भी साथ में कर सकती हूँ. व्हाट इज द ईसीजी? इलेक्ट्रो कार्डियोग्राफी. हमने ईईजी सुना है. ईईजी क्या है? इलेक्ट्रोएन्सेफेलोग्राफी. हम मेथड की बात कर रहे हैं, राइट. इलेक्ट्रोएन्सेफेलोग्राफी. मैंने आपको पहले भी क्लास में बोला है क्या? एनसेफेलिस मतलब द ब्रेन, राइट. एनसेफेलिस क्या मतलब होता है इसका? ब्रेन, राइट. सो एनसेफेलोग्राफी मतलब हम किसकी एक्टिविटी देख रहे हैं? ऑब्वियसली वी आर लुकिंग एट द एक्टिविटी ऑफ द आई, राइट. नाउ ये सारी मेजरमेंट आप कर सकते हो कब? साथ में अगर कर लिया तो ओवरऑल हमें पता चल जाएगा. व्हाट वी कैन नो the heart condition during the sleep, right. We can know the ocular movement during the sleep, and we can also know the brain activity during the sleep. So we are going to combine the results of all of these things, and we are going to study what and how the system changes during the sleep, and that combined study is known as polysomnography. समझ में आ गई चीज? पॉलीसोमनोग्राफी, ठीक है. इन सब को मिला के हम बोलेंगे पॉलीसोमनोग्राफी. ओके, गुड मॉर्निंग फिलिसिया. नाउ एक और चीज कर सकते हो क्या? अगर आपको देखना है मसल मूवमेंट, राइट. हमने क्या बोला? ओनली ऑक्यूलोग्राफी over here, right. So electrooculography, but I want to see how my other muscles of the body, they are reacting during the sleep. So what I can do? I can do EMG, you know. I can do EMG. Now what is EMG? EMG is electromyography. Electromyography. आपके लेवल पे बच्चों टर्म इंपॉर्टेंट है ना. मायो मतलब मसल, वी ऑलरेडी नो दैट थिंग, है ना. इलेक्ट्रिकल करंट जो भी आ रहे हैं मसल की तरफ, राइट, वी आर कन्वर्टिंग इट इनटू अ ग्राफिकल रिप्रेजेंटेशन, एंड वी आर चेकिंग दैट हाउ द मसल्स आर रिएक्टिंग ड्यूरिंग द स्लीप, एंड देयर आर डिफरेंट टाइप्स stages of sleep that we are going to learn, that how they behave during different stages of sleep. Then you can measure the BP with the NIBP machine, non-invasive BP machine. NIBP machine जो हम यूजुअली देखते हैं वार्ड्स वगैरह में. What is that? You are not doing any invasion, right? You are just tying a cuff and you are taking the measurement. So with the help of non-invasive technique, we can measure the blood pressure. If I wanted to check that in the sleep and different types of different stages of sleep, how my BP is fluctuating, in that I have to use the NIBP machine, right? And via that I can know that yes, these all changes are happening during this type of sleep, and that is already done by the scientists. They already told us that if these kind of changes are occurring, that means this stage of sleep is going on. So what we have to do? We have to combine the result and make an interpretation कि क्या टाइप की और क्या stages of sleep is going on, right? Which stage of sleep is going on, and these combinedly are called as polysomnography. It's not the only study of the brain, it's combinedly. You can take the readings of all, and you have to interpret that which stage of sleep is going on. But in this, the main one will be always and always, obviously, that will be EEG, electroencephalography. Okay, so according to the brain activity, agar brain less active hai, if the brain is less active, that means we are going to say that yes, what is going on? The deep sleep is going on. Okay, so that's how we are going to learn about the sleep. लिख लिया बच्चों? लिख लिया? आगे बढ़े. एक और होता है, अगर जैसे हमने हार्ट की एक्टिविटी देखी, वी कैन टेक द एक्टिविटी ऑफ रेस्पिरेटरी सिस्टम ऑल्सो. नाउ हाउ टू टेक द रीडिंग ऑफ रेस्पिरेटरी सिस्टम? वी हैव एन आइडिया. व्हाट वी डू इज वी टाई अ चेस्ट बेल्ट ओवर हियर, एंड इंस्पायर करेगा तो व्हाट इज गोइंग टू हैपन? When we inspire, you know that the thoracic cavity, we already discussed that in recipe, that the thoracic rib cage is going to move upward, outward, and laterally also, right? So it is moved like this. So suppose this is my rib cage. When I'm going to inspire, what is going to happen to the rib cage? Rib cage will move slightly upward, outward, or laterally and forward. ऐसे करके rib cage is going to move. So what is going to happen? If I tie a belt over here and it is attached with the electrode and or it is attached with something that is giving me a graphical representation, when I'm inspiring, the upward wave will come. When I'm expiring, the opposite change will occur. That means my chest is going to go back, or the rib cage is going to go back to its normal size. The chest cavity size is going to decrease. So I'm going to get a downward slope. So इस वाले स्टडी को हम बोलते हैं स्टेथोग्राफी. लिखो स्टेथोग्राफी. इसमें क्या करते हैं? रेस्पिरेटरी मूवमेंट्स. Respiratory movements we are going to measure in stethography. Respiratory movement कैसे करते हैं? With the help of chest movement. Chest movement or rib cage movement. How the rib cage is moving, according to that, that belt will show the upward or downward movement, and that is recorded in the in the recording. So we can measure all these things during the polysomnography, but the main stages of sleep and types of sleep are different. We divide the sleep into two types, that is REM sleep and NREM sleep. Rapid eye movement and non-rapid eye movement. In some books or some literatures, it is written as random eye movement also, and that is also correct, right? But हमारे book में हमें क्या लिखा है? Rapid eye movement. So we are going to stick with that. Both are correct. Both are correct. Non-rapid eye movement. Right? Rapid eye movement or non-rapid eye movement. So NREM and REM sleep, right? चलो, अगर दो phases हैं, so obviously there must be some differences between these two types of sleep, right? So we are going to discuss the differences between these two things right now, okay? So let's see one by one what are the differences that are going to be seen over here. Now, जैसे नाम suggest कर रहा है, what is the name of the sleep? Rapid eye movement sleep. Good morning, Renu. So rapid eye movement sleep. If the eye is moving, obviously some activity of the brain is going on, right? So that's how you can remember that in this type of sleep, the brain is active. So ये कैसी sleep होगी और how the mind is going to be in this? The mind will be active during this type of sleep. So active mind sleep भी बोलते हैं इसको. So this is also known as active mind sleep. Or this is known as, see, during the sleep I told you that the brain is relaxing right now, है ना? दिन भर काम करके थक चुका है. This is going to get fatigue, right? So fatigue मतलब क्या होता है? Accumulation of adenosine. Understand? ATP होगी, right? That is your energy. The brain, whenever it is active, what it is going to do? Either it is going to activate through the glycolysis pathway. So what it is going to do is, it is going to break down the ATP into the ADP first, then the cyclic AMP, and the cyclic AMP ultimately gets break down into the adenosine. So what happens is that the adenosine gives that fatigue feeling, okay? So ultimately what is happening, the breakdown product is giving us the fatigue feeling. That means we are actually using a lot of energy and now it's time to recover from that stage. So we need some rest, okay? But during that time, that means whenever we are recovering, during that time, what I told you, that it's like a temporary coma stage, right? A temporary stage of unconsciousness of the brain or decreased activity of the brain, right? It is temporary stage of, यहाँ पे लिखो, एक बुक में लिखा हुआ है इट्स अ टेम्पररी स्टेट ऑफ अनकॉन्शियसनेस ऑफ द ब्रेन. सो दिस इज ऑल्सो कैन बी योर unconsciousness, right? So brain will become unconscious for some duration of time. So this is temporary. What is the difference between the coma and sleep? Sleep से आप wake up हो सकते हो, right? But the coma, we cannot say about the coma, right? It can be permanent also, right? So but the sleep is temporary state of unconsciousness. Okay, now I'm saying if you're unconscious, your brain activity should be low. Brain should be shut down for some time. If this is like a factory, suppose करो एक factory है, right? रात में we say that in the night the factory is not working. That means the machinery and everything should be off at that time, right? So activity inside the factory is very, very low during the night time, right? But I'm saying over here in the REM type of sleep, this is a type of sleep, but the mind is active over here. So it's a paradox. Paradox क्या होना है? Paradox मतलब क्या होता है बच्चों? Anyone? What do you mean by paradox? I'm waiting for the answers. Paradoxical sleep. Paradox means you assume that this is going to happen, right? But exactly opposite of that is happening. That we say as paradox, right? जैसे for example, एक बंदा है जो खूब सारा पढ़ता है, right? There is one student who read a lot. So what we expect that whenever he is going to give the exam, so he must be getting a good marks, right? And एक बंदा है on the other side, there is another student who do not read for the whole year, right? What we expect that he will not be getting more marks. But what happens? There is a paradox happens that जो ज़्यादा पढ़ता है खैर उसको तो खैर फेल तो नहीं हो सकता, but कुछ कम मार्क्स आते हैं. And suppose करो luck was there or whatever it was there or MCQ question paper occurs and he just the other student who do not read a lot, he just mark, and by his luck or by his fortune what happens is he gets more mark than who was reading. ऐसे नहीं होता है रियल लाइफ में. आई एम जस्ट टेलिंग यू अ फैंटेसी स्टोरी दैट डज नॉट मीन दैट यू शुड लीव रीडिंग एंड स्टडिंग, राइट? सो दिस इज अ पैराडॉक्स. What we thought that he is going to fail, but he got more than the marks than the reading person, right, who was reading for whole year. So that is nothing but a paradox. Okay, so opposite condition happens what we assume to happen, right? Contrast situation occurs what we thought that this is going to occur, right? इसको बोलते हैं paradoxical sleep. Why paradoxical? The person is in the sleep, so we assume that he must be having what? Less activity of the mind, but his mind is rather active during this type of sleep, and that's why this is known as what sleep? This is known as the paradoxical sleep. Good morning, bachcho. Good morning. On the other hand, when we talk about NREM sleep, it is during this stage the mind is inactive, right? As we assumed, right? So alpha block phenomena. Don't worry about this. We are going to read in some time. What is this alpha wave, beta wave, alpha block phenomena, right? Everything we are going to study, right? Okay. Now, यहाँ पे there are two types of waves which are seen. That is theta waves, mainly theta waves, and delta waves. Theta waves and delta waves. What we are going to see over here is theta wave and delta wave. There are two differences. Till now we learn, right? Now REM से क्या याद आ रहा है आपको? REM. So you can remember like this that see dreams are coming in both the types of sleep, NREM also and REM also. But you will not able to remember some dreams. You'll able to remember some dreams. So how is that possible that dreams are coming during the sleep, but some I'm able to remember, some I'm not able to remember? So that must be some difference that is happening over there. So remember that whenever the dreams are coming in the REM sleep, you'll able to remember those dreams, right? If you wake up and you remember those dreams, that means those dreams must came into when you were into the REM sleep. If you woke up, you thought that you have some kind of bits and pieces that you were dreaming, but you are not able to recollect your dream. That means you were in the which type of sleep? NREM sleep. So write down that also. The dreams are remembered over here. Dreams are remembered, and over here they are not memorized, or there is no memory form. So you can write no memory form, or not able to recall. Not remembered. These are not remembered. Okay, so simply you can write not remembered. So REM sleep में the dreams are remembered, and NREM sleep में there is no memory form, so not remembered. Right? Now, what is the next difference between these two sleeps? Give me a minute. अभी तक की बातें समझ में आ रही है बच्चों? Anything that is you are not able to understand till now? यहाँ पे why we are learning about the dreams? याद रहे नहीं रहे क्या फर्क पड़ रहा है ना? What's difference it is going to make? They are dreams, but understand, dreams have some pathways which are made during this type of sleep. So remember, the memory formation, we say that the memory formation, that means the short-term memory is converted into long-term memory. That also happens during the sleep. Now that is known as consolidation of the memory. Consolidation of the memory happens during the sleep. But if they ask specifically, consolidation of the memory happens during which sleep? Definitely that is going to happen during the REM sleep. Whenever the consolidation is going to take place, your brain has to work towards it, right? So that it can be recalled later on, right? So this is going to happen. The memory, if they say, of normal things also, the memory is formed during what stage? The memory is going to be formed during the REM sleep, and there is no or very little memory is going to form during NREM. Why little memory? You can have bits and pieces that you were dreaming, but you are not able to recall right now. So that's why they say no or little memory formation. Obviously बात है, that means memory formation means क्या हो रहा है? Consolidation. You are not forming new things. Whatever you recall during the day, that you are consolidating. So that's why they say that a proper sleep is very important during the exams also. Otherwise, you read at that time, you feel as if you remember, but if there is no consolidation of that memory, you will not be able to remember in the exam. So remember, whenever you are going for the exam, have a good rest, that is 7 to 8 hours, not like 12-14 hours. Okay, so memory formation, that is going to occur during what thing? During the REM sleep. Origin. From where this type of sleep is going to get originated? Remember, there is area, you must have known that there are areas like midbrain, pons, medulla, right? Over here there is an area in the pons that is known as pontine tegmentum. That is known as pontine tegmentum. Pontine tegmentum. This area is going to form the REM type of sleep. Okay, or this area is more active, and this type of sleep is going to get origin, REM type of sleep, from the pontine tegmentum. Now, what about the NREM? See, later on we are going to study about the stages of sleep. In that you will get to know that NREM having 3 stages, right? And it is larger as compared to the REM sleep. Okay, for a longer duration we are in the NREM sleep, the adult person, and then for a shorter duration of time we are in the REM sleep. Now understand, if you have to produce that much of long duration sleep, different areas of the brain, they are going to work towards it, and they are combinedly known as sleep zones. They're combinedly called as sleep zones. Now there are major three areas which works towards it. That is your hypothalamus, midbrain, brain. Sleep must be originated, and if something is originated and that is carried forward, and that too we are talking about the brain, that means who are going to do the work of transmission? Obviously we need some chemicals for that, and that is going to happen with the chemicals. And what are those chemicals then? Different chemicals are going to get released into REM and NREM. This is the active type of sleep. So neurotransmitter involved over here is norepinephrine. Some book says acetylcholine also, but we are going to stick to the norepinephrine. That is the main neurotransmitter in what thing? In your REM sleep. And what about the neurotransmitter over here? NT means neurotransmitter. So write down, there are three major neurotransmitter: GABA, acetylcholine, and also serotonin. Acetylcholine and serotonin. Yes, the serotonin causes sleep. Okay. Now write down the last point: duration. Now understand, there are different duration in the child and adult. Now the children, the infants, the newborns, they have a lot of REM sleep, and that's why what happens, whatever they see, they capture that movement and they consolidate it. Okay, so that's why the memory is formed. And when we say they can easily follow whatever you teach them, they easily grasp those things. Lot many things are taught by many people to that child, but he is able to learn those things, new things, how to talk, how to walk, all these things he is learning in that small duration of time. How is it possible that a small kid is able to memorize so many things? Thanks to this REM sleep. Remember, in the adults, if you calculate the total duration of sleep and you took how much part of the sleep occurred in the REM, only 20%. Only 20% of our sleep time we spend in the REM stage. But the newborn babies, what they do is 80% of their time of sleep is spent in which phase? 80% of their time is spent in the REM stage, and this is very important for memory consolidation, and that's why memory consolidation occur, right? Many new neural paths or mental paths that are formed, right? And because of those neural paths, those synapses, what happens is he is able to recall so much, he's able to retain that memory. Okay, so that is important. Exactly opposite करना है आपको NREM stage में. NREM stage में, what about the duration in the adults? Obviously we spend only 20% there, rest of the 80% of the sleep we spend in the NREM stage. And what about the newborn? Newborns spend only 20% in a NREM stage. NREM is very important for what thing? It is very important for the consolidation of the memory. Okay, यहाँ तक समझ में आया what is NREM and what is REM sleep? हाँ जी बच्चों, please message me whether you are able to understanding all these things or not, है ना? Message me बच्चों, समझ में आया स्लीप कैसे होती है, क्या होती है, क्या टाइप्स की होती है. नाउ वी आर गोइंग टू मूव टू द ड्यूरेशन ऑफ स्लीप, है ना? टोटल ड्यूरेशन ऑफ स्लीप, दैट्स ऑल अबाउट NREM and REM sleep, right? We are going to talk about the total duration of the sleep. What about the total duration? Now understand that when I'm going to say total duration, if I sleep for like let's say 6 hours, The NREM and REM cycle, so first of all we go in NREM sleep, then REM, and then again into NREM and then REM. But first cycle is like this, that हम NREM से REM में जाते हैं, REM से NREM में, right? This cycle continues, okay? No matter NREM की which stages are going to occur, that we are going to learn, but this cycle continues. Now if I have to check how much time it takes for one cycle to occur, that means first NREM stage and REM stage. In how many, how much duration we are going to have one cycle. So many cycles occur during the sleep. Again and again we are falling into NREM, then REM, then NREM, then REM. Again and again these cycles happens. How many such cycles occur during that 6 hours of sleep? How I can calculate? I know that one cycle of sleep is approximately 90 minutes. Approximately 90 minutes. Okay? In some books the range is given 90 to 110 minutes. 90 to 110 minutes. Okay? So approximately 90 minutes we are having one cycle. Okay? So if I say I sleep 90 minutes means 1.5 hours, right? 1.5 घंटा है ना? Right? So one cycle is of 1.5 hour, right? If I say 1.5 hour का एक cycle हो गया, so if I sleep for 6 hours, how many sleep cycles I'm going to have? I'm going to have 4 sleep cycles. Why? 1.5 hour, that becomes 3 hours, 1.5 hour. ऐसे 4 cycle करोगे तो you are going to get 6 hours, right? You are going to get 6 hours. So such, how many total will be 6 hours, right? So I'm going to have 4 different cycles of this REM and NREM continuously during the 6 hours. So if the question comes that one cycle of sleep, duration of one cycle of sleep is how much? It is nothing but 90 minutes. It is nothing but 90 minutes. Okay? Now, let's learn about, okay, good. Thank you, Tanu. Jasmine. Okay. Chalo. So, we are going to learn about the stages of sleep. Okay? Now we are going to learn about the stages of sleep. बड़ी मुश्किल से उठ के आए हैं मैम, है ना? Stages of sleep, NREM. First of all, NREM is divided. It was divided into NREM 1, NREM 2, NREM 3 and NREM 4 type of sleep. But understand, a latest edition of Gnome that says that these two are having no much of the differences, so they combinedly call it as NREM 3. Okay, so now they are calling it as NREM 3, but they can give you in the option NREM 1, 2, 3, 4. So you have to understand, yes, some books are saying that there are 4 stages of NREM, but Gnome says, which we follow in physiology, it says that the 3 and 4, they're having no much differences, and that's why they are saying that this is a one stage of sleep, that is NREM 3. But since we are having these 4 stages, we are going to learn them one by one. So write down please NREM 1 sleep. Now, if we combine these two phases, NREM 1 and NREM 2, as soon as we are going to sleep, we are going to enter into NREM 1 and NREM 2. These two are known as light sleep. And these two combinedly, or the NREM 3 as the latest addition, this is known as deep sleep. What's the difference between light sleep and deep sleep? Now understand. Whenever you are going to sleep, suddenly someone calls your name, you are going to wake up. Oh, kya ho gaya? Right? So that means you were into the light type of sleep. Okay? but you are sleeping so in the deep sleep. Someone calls your name, a band is the bell is ringing, the phone is ringing, and there is so much of the noise is going on outside, but the person is not waking up. No matter how much the people are trying to wake him up, he is not waking up in that much of the noise also. That means he is into a deep type of sleep. Okay, it is very difficult if the person is sleeping and it is difficult to wake up in a particular stage of sleep. That means the person is in the deep sleep. Okay, and easy arousal is occurring from the sleep. That means the person is in the light sleep. Okay, so let's learn. यहाँ पे आप ब्रैकेट में लिख सकते हो easy arousal. What do you mean by arousal? Arousal means you become active, and that is from sleep. Easy arousal or easy to wake up the person, right? And over here, difficult to wake up. Difficult to wake up. Okay, easy arousal, that means you are into NREM stage 1 or 2. If it is difficult to wake up, that means you are in NREM 3 phase, right? 3 and 4. We know that REM it is having a different name, that is a paradoxical sleep. Okay, so 3 stages बन गए. Main चीज क्या? Light sleep, deep sleep और paradoxical sleep. We know if we are talking about light sleep, that means it is NREM 1 and 2. If we are talking about deep sleep, that means it is 3 and 4. And if we are talking about REM sleep, that means we are talking about paradoxical sleep or active mind sleep. Okay, now chalo, it is a light sleep, है ना? NREM 1 is a light sleep. It is a light sleep, right? Then as soon as you are going to sleep, which wave is going to occur? Remember that when you are awake, high frequency waves are coming, but if you are sleeping, that means, just trust me over here, that over here the theta waves are going to start, and some alpha waves are also going to come. Some alpha waves are also going to come. You spend around 5 to 10% of the time into this sleep. 5 to 10% of sleep cycle we spend in NREM 1 stage. So NREM के बारे में only 3 points you have to remember. Light sleep. What are the waves that we are going to talk about? For just now, remember theta and alpha wave. NREM 2. NREM 2 में क्या होता है बच्चों? It is also a type of light sleep that we do not need to study again and again. It is again light type of sleep, but the duration is important. Maximum of the sleep duration you are going to spend into the NREM 2 stage. Now maximum, that means how much? That means almost 30 to 40% of sleep cycle you are going to spend in the NREM 2 stage, right? And that is very important question. 30 to 40% of the sleep you are going to spend in the NREM 2. Now, which waves are going to come? Which EEG waves you are going to see? EEG waves. Now understand, over here also you are going to have same waves, that is more of the theta waves and very few what things? Very few alpha waves. Very few alpha waves. Okay, very few alpha waves. Now when we are going to see the ECG, we are going to find some spindles over here. Spindle मतलब क्या होता है? ऐसे कुछ shape होता है, उसको हम spindle बोलते हैं. We learn about the muscle spindle also, right? ऐसे कुछ shape के if the some side this type this type of if the shape is forming, that means we call it as spindle. Now what happens when we see the EEG waves? The waves are going to be like this, positive slope and negative slope, right? Upward and downward. But in this type of sleep, how we are going to see? So this is like a spindle, somewhat like a spindle, right? And this is known as sleep spindle. This type of spindle is known as sleep spindle. So this is a hallmark. If you see ECG का जैसे strip आता है ना, ऐसे same strip we are going to get for the EEG also, as the strip we get for the ECG. There are some particular types of wave patterns that are going to form, and that's we usually identify. Nobody is going to ask you at your level, but you should know that yes, such type of sleep is going to such type of patterns are going to occur, and now you have to identify that which type of sleep it is, or in which phase of sleep the person was. So if you see something known as sleep spindles, you have to identify that the person must be in the type 2 NREM sleep, and there are cursive K-like complexes. So some complexes are going to take place, and that is known as K complexes. These two are the hallmark. These two are the hallmarks of cursive K. ऐसे कुछ लिखते हैं ना. So ऐसी कुछ waves आई. So क्या याद रखना है? Cursive K ऐसे होता है ना? I'm not that good in the cursive K, but it looks as if it is a cursive K, right? So that's why it is also known as K complexes. Such complexes are going to be seen, and that is known as K complexes. Okay, so these are two hallmarks of what thing? These are two hallmarks of the NREM 2 stage. Let's move on to the NREM 3. NREM 3. Now यहाँ पे क्या हो रहा है? We are entering into the deep sleep, right? We talked about NREM 1 and 2. They are light sleep. Now over here, what we are starting with? We are starting the deep sleep. So we can write deep sleep begins over here. Deep sleep begins. So we started to go from the light sleep into the deep sleep, right? Now D for deep sleep and D for delta wave. So which wave we are going to find over here? In the EEG, if we see on that strip, we are going to find delta wave. So how to remember? D for deep sleep, D for delta wave. D for deep sleep, D for delta waves. Okay? Duration कितनी होती है? इसकी भी around 5 to 10%. 5 to 10% of the sleep cycle you spend in this cycle, this stage. NREM 4 stage, as per the new, as per the old edition and new combined it into 3 itself, right? Now this is known as classical deep sleep. Classical deep sleep. Now why it is known as classical deep sleep? Now understand, maximum delta wave. Maximum delta waves, they are going to appear in this NREM 4th stage. And what I told you about the delta wave, D for delta, D for deep sleep. So that is showing a maximum deep sleep, right? So how much? More than 50% of the delta waves, more than 50% of the delta waves in the whole strip, if you are going to see in one stage, that means it is nothing but the NREM 4th stage. So obviously more than 50% यहाँ पे दिख रहा है. So less than 50% of the delta wave you are going to see over here. That's so easy, right? More than 50% you are going to see in NREM 3, and in the NREM 4 you are going to see more than 50%, right? Now in the recent edition 3 and 4 they are combined, so obviously delta wave you are going to see in the NREM 3 if you are in the new edition, right? Chalo. Now what are the phenomena that you see during the sleep? Let's learn. We do have time. What are the phenomena that occurs during that sleep or in deep sleep, especially in the deep sleep? This is going to be very, very interesting. Now why I'm saying so? Let's see. Over here the dreams are going to occur, right? I told you that dreams are occurring in both the phases, right? So dreams occur over here mainly in the deep sleep, but NREM chal raha hai, so it will not be able to remember, right? So they are not remembered. They are not remembered. They are not remembered. Now, second thing, there is something known as night terror and there is something known as nightmare. Now, what do you mean by night terror and nightmare? Usually, the layman people or the people in general, they use those terms simultaneously, but they are having a slight difference. Now, what is that difference? Now, remember, when you are in the NREM stage, you get night terrors and not nightmares. How to remember? Now remember, night terror, let's write about night terror and then I'll talk about the nightmare also. Night terror. Now what do you mean by night terror? It's unknown fear that happened during the sleep. Now what I mean by that is, you're sleeping and suddenly you wake up with the fear and with the stress and your heart is racing. That means your heartbeats are higher, you are sweating, you are anxious. In such condition, suddenly if you wake up, that means, and you do not know why that happened, right? That means that is known as night terror. First of all, write down what is it. It is unknown fear during the sleep. If you wake up with the unknown fear during the sleep, you do not know what was the fear, to what thing you actually got scared. You were to sleeping, right? The thing is that you saw the scary dream and you woke up, but the problem over here is that you are not able to remember that dream, and that's why you do not know. It is the unknown fear. Understood? Matlab, when we were sleeping, we saw a dream which were very, very scary, right? And that's why our heart rate was beating faster and we are sweating, we are anxious, right? And that's why something bad happened and we woke up suddenly, right? Because of that stress phenomena. And but after waking up, we are not able to recall. हमें नहीं याद आ रहा है कि हम क्या सपना देख रहे थे, right? It was एक डरावना सपना था, but we're not able to recall it, है ना? So that's why it is called as unknown fear or fear of unknown, right? Now, if we talk about nightmares, this is different. Nightmare usually they are remembered. So कौन से sleep में आ रहा होगा बच्चों? They are remembered. So scary dream occur during what thing? Scary dreaming occur during an REM type of sleep, and it is remembered after you wake up. That means you were watching that, or you were experiencing that dream in the REM type of sleep. Okay, so that's the difference between nightmare and night terror. NREM में हम night terror की बात करते हैं, not the nightmares. Okay, now some people have the condition of sleep walking. They walk during the sleep. Sleep walking. They walk during the sleep, and that is known as somnambulism. Somnambulism. Some people, they do have that habit to walk during the sleep. So that is a abnormal condition that happens during the NREM phase only, when they are in the deep sleep. Okay, so sleepwalking, that is known as somnambulism, right? And obviously the person, how he is in which type of sleep? The person is in the NREM sleep, so he will not be able to recall that how he reached there, right? So he is walking in the sleep, right? And his brain is not forming any sort of memory of that walking, and that's why he will not be able to remember when he is going to wake up. He will not be able to remember how he got up from the bed and reached where he walked through towards. Okay, now some people have that condition in the sleep. They clench their teeth, right? ऐसे ऐसे उसको बोलते हैं teeth grinding. Okay, and उसको ही हम scientific term में बोलते हैं bruxism. Okay, or teeth grinding. Now, when we talk about teeth grinding, usually it is seen in the children. Okay, now there is a problem in the teeth grinding. Like that, if the bacha or that child is grinding the teeth during the sleep, the problem is that the tongue can come between the teeth and he can bite up the tongue and there can be a harm to a tongue. So better kya hai? If the mom knows about the teeth grinding, better is give some protection. What we do is we keep a rubber pad between his teeth so that even if he grind his teeth, there is no harm or a hurt that is going to happen to his tongue. Okay, and mainly this happens during the NREM. Mainly this happens during the NREM stage 2. NREM stage 2. I know that deep sleep 3 and 4, but mainly this is more in stage 2 than the stage 3 and stage 4. Okay. Then some people talk also during the sleep. Whatever they are talking, they are not making sense, or sometimes they make the sense. So some people have the habit of sleep talking, and that also happens during the deep sleep. So somebody is talking during the sleep, so that means he's in the deep sleep. Okay, babies or the newborn children, not the newborn infants, also till the 5 years also. Even after having the potty training, right? That means a toilet training. Some people or some children do wet their bed during the night. So this is known as nocturnal enuresis. Uresis matlab they pass out the urine during the night. And night को ही हम बोलते हैं क्या? Nocturnal enuresis. That means bed wetting. इसी को हम बोलते हैं layman term में bed wetting during the sleep, in sleep, right? So it is normal till 5 years of age. It is normal till the 5 years of age in children. Obviously, I'm talking about children, 5 years of age. Why it is normal? Because remember, sometimes what happens is our neural pathways are not yet fully developed till 5 years. Okay, bladder and bowel के जो pathways होते हैं, the pathways of bladder and the bowel and bladder, they are not fully developed till the 5 years. So what can happen? That during the sleep they are inhibited further, right? So there is no control on them. Usually what happens is when you are awake, you usually inhibit them. Okay, the cortex part, they inhibit them. So that's why they can control their urine, right? And whenever they are going to go to the toilet, then only they are going to releasing it. But during the sleep, that inhibition is gone. There is no control over that pathways, and they are not fully developed, right? So they cannot work on their own. So that's why they are going to release the urine whenever the stress reflex is activated in the bladder. That is nocturnal enuresis. Okay. Now, so these are the changes that are going to happen during what stage? Sleep paralysis. Sleep paralysis we are going to talk about, Pooja. Pooja, sleep paralysis that is going to happen in the REM sleep. Okay, not in the NREM sleep. Now understand, in the NREM sleep, your brain activity is already low, and the muscles. If the brain activity is already low, you cannot give the action to the muscle, or you cannot stimulate a muscle to contract. So we do not need the sleep paralysis in what type of sleep? NREM sleep. So let's learn REM sleep के बारे में थोड़ा सा, as the Pooja suggested. But she made a point over here. Very nice. REM sleep में क्या क्या होता है? This is known as paradoxical sleep. We know that, and the brain is active during this. Hallmark क्या होता है इसका? Hallmark होता है, there is something known as, see, I told you that this is originated from the pontine tegmentum. So यहाँ पे कुछ spikes आती है during the suddenly during the sleep. There are some spikes in between. It is seen, and they are known as PGO spikes. Now, what is this PGO spikes? Remember, this is nothing but pontogeniculo-occipital spike. These are originated from these areas, pontogeniculo and occipital area. So that's why this is known as pontogeniculo-occipital spike, or simply PGO spikes. So whenever we are going to see the PGO spikes, then we can know that yes, what is happening? The REM sleep is going on. In the males, so first of all, what Pooja says is, the mind is active. The mind is active. If the mind is active, you can kick, you can do the boxing during the sleep, right? And you do not know even that you are doing it. So it can harm you as well as the person sleeping next to you, right? So the nature has given a protective phenomena more towards the who is sleeping to your neighboring side, right? So what is that phenomena? Our muscles below the neck, they are paralyzed. Okay, so इसी को बोलते हैं muscle paralysis during the sleep. One area is activated that is known as locus coeruleus. Locus coeruleus, that is going to release what in norepinephrine, and that causes the muscle paralysis. How it exactly causes the mechanism is not yet fully understood to the scientist also. So just for now इतना ही याद रखना कि locus coeruleus नाम का एक area होता है that is going to release the norepinephrine and that causes muscle paralysis below the neck. If the person suddenly wakes up from the REM and the muscle paralysis is still going on, it will take like few seconds to subside. So sometimes it feels like you are not able to move your limbs, but that is normal. That is normal. Nothing to get scared of. Okay. Now, mind is active, but you are sleeping. So mind is kind of confused. So irregular respiration is going to take place. Some activity is going on, right? The respiration tries to get faster, but since the sleep is there, it is the person is sleeping, parasympathetic activity is higher also. So there is the respiratory system is not able to understand that what is going on, right? Once the active mind is there, that is sending the signal, but parasympathetic system is also higher. So respiration becomes irregular. The regular tone is gone, and now the respiration becomes irregular, right? And if we see in the EOG, the movement of the eye towards the movement, we can see a little too high activity, which is not seen in the REM sleep, right? यहाँ पे the activity will be little to higher activity we can see, right? Various range of activities are seen in the EOG. It should be silent, right? But it is not silent. Why? Because we are in the rapid eye movement sleep. The name itself is telling us what is that? That is the rapid eye movements are going on, right? Over here, active dreaming is occurring. What do you mean by active dreaming? The mind is active and you are dreaming like any scene, right? That means you are fighting, you're doing something in that dream. That is active dreaming, right? And that's why it is important to have the muscle paralysis below the neck. That is also known as, so for the protection we have body paralysis, especially below the neck, and that is produced by locus coeruleus, which release the norepinephrine. And that's how we also learn the neurotransmitters also. The norepinephrine plays a role in the REM sleep. In the males, penile erection will occur. That is normal, right? Active dreaming occur, and that dreaming is well remembered. When you wake up, you are going to remember that dream. It is well remembered, okay? Well remember. And which type of dream you are going to have? यहीं पे लिख लेते हैं. Well remembered dream. And if they are scary, they can be scary. They are not. They can be like usual or regular dreams, right? I don't know whether there is such term or not, but not scary, right? If they are scary, we are going to call them as nightmares, not night terrors. Why? Because you are able to remember them and it is occurring in the REM sleep. You know, heart rate बढ़ जाती है इस type of sleep में, and BP also rises. Okay, so both the things are going to take place. So that is all about the sleep. थोड़ा सा waves के बारे में पढ़ लेते हैं and then I'm going to leave you. Okay, so थोड़ा सा wave के बारे में पढ़ते हैं for next like 10 to 15 minutes, right? Write down EEG waves. EEG waves. Okay. Now understand there are 4 types of waves. Depending whether the brain is active or sleep, we are going to divide them like that. So suppose the brain is awake, and the brain is in the sleep. Okay, awake के भी दो phases हो सकते हैं. You are just awake and you are doing very nice, class or some activity, you are giving exam, right? So the mind can be very active, or the mind is calm, composed, relaxed mind. You can say the mind is relaxed, right? You are not doing much of the things. Okay, and sleep में भी हमने दो phases पढ़े. It can be a light sleep or it can be a deep sleep. Now understand, when I mean very active mind, that means you must keep the eyes open. The eyes are open and the mind is active, such as, for example, you are giving the exams. So which waves you are going to see? The wave you are going to see is the beta wave. You are relaxed. Suppose the best example of this is yoga. Suppose the eyes, in this type of condition, the eye must be closed. Eyes are closed and the mind is freely wandering. You are not having any sort of boundary on it. So mind is relaxed and it is freely wandering. The wave that you are going to see is the alpha waves over here. Alpha waves. Okay. Let's talk about the light sleep. I'll change the color. Light sleep. What about the light sleep? You can write it on the other page also. Light sleep mein we already saw that it happens in NREM 1 and 2. And which waves you are going to see? Types of wave that you are going to see is mainly theta. ऐसा साइन होता है थीटा का. Mainly theta. Deep sleep. This is nothing but all the stages that are occurring during the NREM 3 and 4. NREM 3 and 4, right? And the wave mainly is seen D for deep sleep and D for delta waves. Right? Now, let's see what are these four types of waves and how they are formed, right? So, कैसे याद रखना है? You have to remember via bat dance. There is a mnemonic which is known as bat dance. During the night, who is dancing? The bat is dancing. Chamgadar बोलते हैं, right? हिंदी में. In Hindi, it is called as chamgadar, right? Bat is dancing during the night, and that's how you can remember. B for beta wave, then comes your alpha wave, then comes your theta wave, and then comes your delta wave. Now understand why I'm writing so, because there are some frequencies that we are going to talk about. Frequency. And the frequency of wave, it is directly proportional to the activity of mind. Now what I mean by that, more the mind is active, more frequently it is going to give the wave, right? The frequency will be higher. Example there. Suppose my waves are coming like this. That means my mind is relaxed. Okay, in 1 second, how much waves comes? We calculate that in a hertz. Tuning folk का भी होता है. We calculate in hertz how many waves are coming per second. Okay. Same thing, if I say that my mind is very, very active, then it is going to give waves like this. Many waves. Why? Because many neurons are active, right? Many neurons are showing the activity, and that's why I'm having the active stage of mind, right? So similarly, how much frequency you saw in the EEG, based on that, you are going to have these waves. So these waves are EEG waves, okay? P wave, QRS complex, T wave. When we talk about that, we talk in terms of what thing? The ECG, right? And when we talk about alpha, beta, delta, and theta, we talk in terms of EEG waves, okay? Now understand. अगर हुआ 0 to 3 frequency, so you are going to see the delta wave, okay? 0 to 3 frequency. That means per second, if I count a wave and they comes out to be 0 to 3, it can be 2, 2.5, 1 wave, only 2 waves, right? Then that means the person is in the deep sleep, right? But if I say I got 4 to 7 waves, that means the person is having which wave? That means the person is in the light sleep. 4 to 13 waves, right? 4 to 7 waves. 4 to 7 waves, that means the person is in the delta. If I saw 8 to 13 waves, then that means the person is in the what stage? The yoga kind of stage, right? And if I saw 14 to 30 waves or 14 to 30 hertz, that means the person is in the very active stage of mind, right? So how we are going to write? Bat dance, beta waves, they are 14 to 30 hertz. Alpha wave, 8 to 13 hertz. The theta wave, that is going to be 4 to 7 hertz. Per second, I'm going to see these many waves. And if I talk about delta wave, that means the person is in the deep sleep and the mind activity is very, very slow. Now, the last phenomena or last thing for the class is that we talked about some alpha block during the REM sleep. Okay, I'm saying that the brain activity during the sleep should be low, but in the REM sleep, the opposite, the contrast situation is seen. In that, during the sleep, बीच में क्या जाता है? See over here. Suppose 3 to 7 waves. Why? Because the REM sleep and the non-REM sleep is coming. But suddenly what happens? When the REM sleep comes, you're going to see the alpha waves and alpha wave. Suddenly alpha waves aate you're going to see beta waves in between. So it seems as if the alpha wave were going on and it is blocked by the beta waves. It is blocked by the beta waves. So alpha waves were going on and it is blocked by the beta waves. It looks as if like that. It is the beta waves are blocking the way of alpha waves in the REM sleep, right? So it is known as, it is looked as if, it seems as if the beta waves are blocking the alpha waves, and after certain time again the alpha wave will start coming, right? So it looks as if for some duration the beta wave has blocked the way of alpha wave. So that's why this phenomena is known as alpha block. Alpha block. अगर alpha block कहीं पे आपको दिखाई देता है, that means the alpha waves are going on. The frequency is between the 8 to 13. 8 to 13 frequency के बीच में ही आपको दिखाई देता है ऐसे कुछ around 30 waves suddenly per second. So that means what is going on? This is the hallmark. That means you can say with the guarantee that the person is in the REM sleep. That the person is in the REM sleep. So that's how you can identify the sleep depending on your what thing? Depending on your the chart of the EEG. So what we learn? We learn the sleep stages, right? First of all, types of sleep, NREM, REM, right? Then we learn about the sleep stages. What is the NREM 1, 2, 3, 4, and what are the phenomena that occurs during this? We learn about the alpha block also, difference between REM sleep and non-REM sleep, right? And lastly, we learn the EEG waves also. EEG waves also, right? The EEG waves were given by a scientist which is known as Hans Berger. Hans Berger. It's not burger बच्चों, it's Berger, right? It's Berger. Hans Berger ने ये waves दिया था, so that's why they are known as Berger waves also. They are known as Berger waves also, right? So Hans Berger. So Berger waves. Okay, so that's all for today's class. I hope you understand everything. If you have any doubt, please do ask, and please submit your the assignments. Okay, chalo, take care and enjoy the weather. Okay, see you in the next class. Chalo, bye bye bachcho, and study well.